All right, good afternoon, everybody. I see we have people still joining us. Welcome to the Ambulatory M&A Advisors webinar on examining joint ventures between hospital health systems and urgent care. My name is Richard Romero. I'm the head reporter for the Ambulatory M&A Advisor. We are a publication that covers operational, transactional, legal, and financial issues in the ambulatory world. And our webinar today is sponsored by Ambulatory Alliances, LLC, a middle market boutique investment banking strategic advisory firm. It's involved with the buy side and selling side and focuses exclusively on healthcare services and more specifically outpatient centers and physician practices. Luckily today we have joining us on our panel Joshua Kaye, Managing Partner and Chair of the U.S. Health Sector for DLA Piper, Dr. Lee Resnick, CMO of WellStreet Urgent Care. We have Steve Sellars, CEO of Premier Health, and Todd Latz, CEO of GoHealth Urgent Care. We wanted to thank them very much for joining us today, and we want to thank you for joining us today and taking your time out to listen to this webinar. So we're going to jump into the first question. How are you doing, guys? Welcome.
Thank you.
Thank you.
Thank you.
All right, so remember, questions will be answered at the end of the presentation, so if you need anything, feel free to type a question into the question box, and I will send it their way at the end of the presentation. So question number one, why are so many hospitals buying, building, or joint venturing with urgent care centers? Todd, what's your take on this?
Thanks, Richard. You know, I think what we're seeing, and this is true, I think, more broadly across the healthcare and health system spectrum, but health systems are looking for access, especially as they continue to consolidate and to integrate. And one of the main ways they're doing that is trying to meet patient needs for care in those patients' own communities, you know, where they live and work versus the sort of more classical hub and spoke where everything is consolidated into a big acute facilities. And you know, one way to do that is through primary care practices, but that can be very expensive to set up and to support. And you know, many health systems have primary care networks that do not support themselves from a financial standpoint. And urgent care is a great way to get that access into those communities and do it in a profitable way as well. And it can be a big marketing billboard for the system as well. And then I think we can never forget those sort of upstream or downstream referral streams that they get for specialty, whether that's, you know, additional labs, imaging, and so forth that come from that access point of an urgent care. And I think, you know, the other piece that we're going to talk about a lot today is joint venturing with independent urgent care operators. And I think that from a health system standpoint can lead to greater speed to market, better ancillary or ambulatory expertise in that particular field, and then certainly in some cases true that retail sort of business to consumer, business to patient experience.
All right, thank you. Thank you. Joshua, do you have anything you'd like to add to that?
Yeah, certainly. Josh Kaye here. So we're working with health systems and other providers that view the urgent care as a necessary extension of their outpatient sector strategy. So it's actually fitting into a broader strategy in which health systems are looking to capture a number of ancillary services that are ancillary to the health system. From an urgent care perspective, in many instances, hospitals are establishing them as a defensive mechanism to prohibit other health system or other perhaps urgent care center operator from considering entering into the market. And we also see health systems using urgent care centers to capture greater market share by establishing some sort of a foothold in perhaps a competing health systems market as a means to capture a patient population that may otherwise end up in the emergency room of the competing hospital. The urgent care center may serve as a mechanism to bring patients closer and get brand recognition of their health system. So from a strategy perspective, that's how we're seeing it. Certainly, to the points that Todd raised in terms of patient access, obviously critical to a successful strategy in urgent care, and certainly the fact that payers and just the entire health delivery system is focused on trying to find more affordable and more efficient ways to deliver care. An urgent care platform can meet both of those criteria relative to an emergency room.
Great, thank you. Let's see, Lee or Steve, do you have anything you'd like to add to that before we move on?
Sure. This is Lee. Go ahead. Go ahead, Steve.
Go ahead, Lee. Go ahead.
All right. So this is Lee Resnick. I would add two other layers actually. One is the other panelists have talked about capturing market share and downstream referrals. I have a nuanced way to look at that, and that is when health systems are looking to reduce leakage from their network. So the fact of the matter is that in your region, if a patient goes to a competing health system to access care, as Todd mentioned, say for acute care, they go to the ER, they go to the urgent care, that patient's likely to get a referral there. That referral is likely to be with the competing health system, and so that causes leakage out of the network. Once they're then embedded with this now competing health system, they establish a relationship, and they might lose that patient. So that may have been a patient that was part of their network that becomes lost due to leakage. And the only other thing I would add is with the emergence of value-based reimbursement, which is on everybody's mind in the health system world. Nobody really quite knows where it'll end up. They just know that it's headed there. And with value-based reimbursement, you're essentially incentivized to manage the care of your patients. So it's almost like flipping the old managed care days on its head and incentivizing the actual providers to manage the care instead of having the insurance companies manage the care. Well, in order to do that, you have to have a closed network to manage care, and urgent care they see as a critical part of keeping the network closed and, again, preventing leakage.
Thank you, Lee. Steve?
Yeah, I certainly agree with all the comments made by the other panelists. I would add just a couple of other things. A good urgent care model is capable of expanding the health system's brand name recognition if the partnership uses the health system brand. So it's a way for the health system to get that brand name throughout the community. If it's a multi-site, well-developed urgent care model. Also provides a coordinated approach to care, including after-hours care, eases pressure for on-call physicians that are part of an affiliated primary care network, and eases crowding of the ER by helping to keep minor conditions out of the emergency room, enabling the ER to focus more on true emergencies, which ultimately leads to higher patient satisfaction for the health system.
Perfect. Thank you for your answers. We're going to move on to the next question, which is how are joint ventures between urgent care and hospitals being structured in the current market? Now, Joshua, I believe this is definitely your forte, so why don't you go ahead and take it away?
Yeah, absolutely. There are multiple ways in which these models are being structured. I would start off by saying that the first question we're typically asked, or one that we ask the client to focus on, is the patient population that's going to be served, because that could really impact how a joint venture would be structured. In our view, often these joint ventures are intended to serve really 3 or 4 different types of market segment. The first being whether or not the joint venture is intended to serve an underserved secondary market population. So is there a lack of access in that area, and is that the driver of the joint venture? In the alternative, are we looking at high-end, prominently placed retail locations that are probably catering more towards brand recognition and potentially commercial payer contracting strategies? The third could be employer-based insurance plans, and is the idea here to service that type of a population, such as in servicing Disney World's employee beneficiaries or something along those lines. all of those need to be taken into account in terms of understanding the population that ultimately could end up driving the way in which the joint venture is structured. In terms of the JV, once the population is assessed, then the focus is really into what are the resources that are needed for the JV to be successful. Is this one where we're looking to work off of the hospital's EHR system? Who's going to be providing the space? Who's going to be providing the equipment? Who's going to be providing the personnel? What that will often dictate, or the answers to those questions will dictate, is whether the JV is going to be structured in a true equity joint venture model, in which the hospital and the other party will be joint equity partners in an urgent care platform, or in the alternative, is it going to be operated as an extension of the hospital, and the hospital is simply outsourcing certain components, or a turnkey operation outsourced to a turnkey manager for the venture, in which case the relationship is much more contractual in nature. The other thing that also needs to be considered is that many states prohibit the corporate practice of medicine, and so that can be a driver in terms of how the model will be structured and whether or not the actual entity that's providing the urgent care services, will it be employing physicians, and if so, does the state in which the model is being operated require a physician shareholder or some other, or a hospital to be the shareholder of that practice entity?
All right, perfect. Thank you. Thank you very much. Let's see, Steve, do you have anything to add to that one?
Yeah, I'll throw a few things out. I mean, we typically start by making sure that the business and corporate goals of both parties are aligned. That requires that you assess the suitability of the potential joint venture partnership for fit within the health system strategy, and compatibility from the standpoint of being able to work together. You know, how many centers are you proposing to open? How will you staff the centers? Will they be staffed by physicians, PAs, nurse practitioners, hours of operation, you know, IT, EMR systems, how will they be marketed, branded, scope of services, etc. In terms of structure, as Joshua said, I mean, we have to determine the equity ownership structure. You know, our partnerships are usually 50-50, but that's not to say they all have to be. I've seen a number of other models where, you know, there is a majority owner. These partnerships also require the completion of the appropriate partnership documents, normally an operating agreement completed between the partners that defines the geographic region or the non-compete service area, defines governance and general managerial power and authority, how to treat the health system's brand, and completion of a management agreement that sort of outlines the responsibilities for day-to-day operations, hiring, training, management of staff, policies and procedures, compliance, quality management. All of those things are very important to address in structuring a deal like this.
All right, thank you. We're going to go ahead and move to the next question. What are the roles and responsibilities of each party in this type of a joint venture? Lee, why don't you help us out with that one?
Sure thing. So the answer to this question depends on the level of integration. So Josh and Steve talked about different types of joint ventures, and so that's going to dictate, of course, the level of your role of responsibility. If you're in a fully integrated network where you are essentially part of the health system, and that may mean that you're part of a clinically integrated network from a contracting standpoint, and you may contract within the health system's contracts, payer contracts. You're going to have to do several things in order to uphold your responsibility. One thing, first and foremost, you have to be able to manage clinical and operational metrics in a sophisticated fashion. To give you a couple examples of these, quality metrics like PQRS, satisfaction metrics like Press Ganey, you're going to be held accountable to your performance in these areas, and the only way you can ensure the performance is to measure them and to manage them relentlessly. You also have to be responsible for clinical integration with referrals and admissions within the network. That also depends on the level of integration and the structure of your joint venture. You may have to credential your providers within the health system, which may have different credentialing policies than you do as an independent operator. There is a strong management interface along with the obvious clinical interface with others in the health system. There are politics, territorial needs that the health system has, so they may say, hey, we really want you to be in this region. That's a highly important, strategically important area for us. It may not be on the top of your list from a business standpoint, so you have to consider that. The big one for me, the two big ones are EMR and workflow management. Health systems ideally want you fully integrated on their EMR. They've been tolerating independent operators kind of drawing a line in the sand around this because it dramatically impacts workflow. There's a lot of anxiety around using a health system EMR in an urgent care environment. This is an important bridge, important challenge that we have to overcome in order to make these ventures fully integrated.
Thank you, Lee. Todd, do you have anything to add on to that?
Sure. I think that Lee makes a number of good points. I think the EMR piece is key. We have joint ventures where we share EMR with our health system partner, and that certainly has an impact on workflow and how we interact with one another and who controls which piece. I would say, generally speaking, that's up for negotiation, the roles and responsibilities in each individual joint venture. There are certain things that are driven by corporate practice of medicine, so Josh raised that a little bit earlier. That can drive both structure behind the joint venture and then who takes certain responsibilities. But I think what we see more often than not is having the independent urgent care partner essentially having the vast majority of management responsibilities, who certainly can bill and do all of the revenue cycle activities on the health system's tax ID, and a lot of that again has to do with the nature and the structure of the joint venture and what you're going for, right? And you might see some different models based on whether you're leveraging a truly clinically integrated network, as Lee mentioned, or if it's a little bit outside of that more integrated, holistic approach. But again, as he mentioned, that the credentialing, privileging of physicians is often a role you will see the health system play, and then depending on the ownership structure, you might see a few other things. I would say more often than not, we see the management company, the independent operator, handling all of the accounting and finance components as well. But if a health system feels strongly about being able to consolidate the joint venture within their financials, you might see some of those roles and responsibilities slide back to the health system.
All right, thanks, Todd. We're going to go ahead and move on to the next question, which is, how is operational and financial control assigned? Steve, I'm going to let you start that one off.
I'm sorry, you cut out on me just a second there.
Okay. Question, how is operational and financial control assigned in a joint venture?
Well, operational control, I mean, it goes back to how the deal is structured. I mean, when we put our partnerships together, part of that is completing a management agreement that outlines the responsibilities for day-to-day operations. Again, going back to who's responsible, for site selection, hiring, training, management of staff, policy and procedure development. Who's responsible for each of those different aspects of the operation? We generally put together a responsibility matrix that outlines that. And so we're very clear on, the responsibilities of both sides. From the financial standpoint, I think that goes back to, how the equity ownership piece is structured. If it's a 50-50 relationship, it might involve a scenario where whoever's doing the front end pre-operational startup services receives some compensation for completing those tasks, and then everything beyond that in a 50-50 scenario would be split based on the pro rata shares of ownership.
Okay, thank you, Steve. Lee, do you have anything to add to that?
No, sir.
Richard,
All right, how about you, Todd?
I'm sorry, Richard, did you throw that to me?
Sure, yes, I did throw that to you, Todd.
Sure, yeah, I think, I think Steve's on it. I think the question is one of structure, so this plays into the previous question as well. What's the structure of the joint venture itself, and what is the health system trying to achieve, right? If the health system is really looking for downstream referrals, or as I believe it was Lee who mentioned, you're trying to take care of that leakage issue, they may be less interested in true operational and management functions. It's really the notion of having an interest in these joint ventured urgent cares and getting them out into the community. If it's truly going the route of a much more integrated 50-50 joint equity joint venture in a clinically integrated network context, then I think you're going to see a lot more push and pull from the health system to want to either be involved from a management oversight standpoint or to really drive some of the components of what might more customarily be done by the management company, and that could be the tracking of clinical and quality measures and even other workflow and operational metrics.
All right, thank you, Todd.
Rich?
All right, yes.
It's Josh Kaye here.
Go for it.
I just want to bring up one other point on the financial control, only because we have seen it come into the mix on some other urgent care operators that we've been asked to work with sort of at a later stage. In some instances, the growth of the urgent care platform may be driven or the capital for that may be obtained through a third-party lender. And for those who are operators out there, you just keep that in mind, that lenders are going to look for the appropriate level of collateral and security in any type of financing transaction, and that can create some degree of a tension between what the hospital's expectations are relative to perhaps the joint venture partner. So again, to the extent I would just introduce the idea that if a third-party lender is going to be involved, there may be some other considerations that need to be taken into account, particularly over the securitization or using the accounts receivable as collateral for whatever loan may be obtained for the purposes of building out a broader urgent care strategy or operating multiple units.
All right, thank you, Joshua. So next question, I'm actually going to hand over to Lee first. How is branding handled in these types of transactions?
So like many of these other questions, it's largely dependent on the agreement that you have with the health system, the location of the health system, the regional dominance of the health system, the strategy of the health system. So it goes on and on. In our region in Atlanta, we partnered with a dominant regional provider, and while we were very proud of our olive 3-year reputation that we had built, it became pretty clear that the Piedmont name, which is our health system partner, was by far the more recognized name in our market. And so you have to kind of let those egos go to the side for this exercise, because it's certainly not about ego. We added we added our name to the logo as the operator, but we were not center stage, so to speak. I think at the end of the day, it's important for urgent care operators to remember, this is back to that ego piece, brand is probably overvalued internally and undervalued out in the communities. And the reasons for this are well known. In large part, even within a single region, healthcare is hyper-local. And so you may have 8 of these across Atlanta, and you will get some brand recognition from that. But at the end of the day, if I'm in suburb X and you have a site there, it's kind of all I know. So I think that this is one of those things that may have more importance to the health system and may be of greater value if the health system is dominant in the region.
Okay, thank you. Todd, what are your thoughts?
Yeah, I think Leah's making a good point there. I think there are really two schools of thought on the branding from a broader perspective when you're talking about ambulatory care, and certainly on a national context. I guess I'll start by saying we see it in probably 4 different buckets. The first would be what Lee mentioned, which I would refer to as the powered by type of co-branding, right? So you have the health system, big logo, but with recognition of who the true operator of the clinic is. In our context in joint venturing, in our partnerships that we have today, we have what I would refer to as more of an equal billing co-branding. So you have the health system as the endorsement brand, getting to the the quality, the clinical reputation, their presence in the market, and then you have our GoHealth brand speaking to that purpose brand who's doing the operation and more of that retail hospitality component of today's urgent care. I think the third variation that we see in the market is the affiliated with concept. You see that CareSpot, for instance, in their partnership with Baptist in Florida, uses that model. And then the fourth category, I would say, is more of a white labeling, right, where you have a true joint venture. The independent urgent care operator doesn't have its name in the branding, so it's purely white labeling with the health system, but they're doing a ton of the work behind it. And Steve would certainly be better than I to speak to that, but I believe that they do some of that. And what I mean by at the beginning of my comment about 2 schools of thought is if you're going to be more broad, if you're going to be more of a national presence, the options are to either brand everything very locally, as Lee suggested, and I come before urgent care, I was in the imaging world, and we had over 100 facilities around the country, and we did exactly as Lee described. Each one of them was branded to that local micro market versus having a big corporate name across the country. And the other alternative is obviously the opposite of that, which is trying to establish a national brand. But I think if you really focus on this joint venture concept, there is no question that there is significant value in using your dominant health system partner's brand name and what that means to players in the community. And I can speak literally for myself. One of Lee's locations is right around the corner from my house in Atlanta, and it had a different perspective when it moved from WellStreet by itself to Piedmont WellStreet, and I think that that's a pretty commonly held belief.
Great. So what I'm going to do, we have reached the halfway point. So I wanted to reach out and say thank you once again to Ambulatory Alliances for sponsoring this webinar. If you're looking to buy or sell a healthcare service or outpatient center physician practice, be sure to visit www.ambulatoryaLliances.com, and they'll be able to get in touch with you and hopefully help you out. Moving on to the next question. This will actually go to Steve. What benefits do each party bring to the table in a joint venture?
Well, there's a number of things that, again, from when you're putting these partnerships together from the health system standpoint, there's a number of advantages there, a number of benefits, expands that brand name recognition, access point into the system, ease in the crowding of the emergency department, creates cost savings to the health system. A lot of health systems are large employers, self-insured employers, so certainly an advantage from that standpoint if they're able to keep their own employees out of the ER. And we talked earlier about just avoiding unnecessary ER visits. From a management company or the urgent care operator standpoint, still again improving access to care, potentially providing better coordination of care across the providers within the healthcare system. Hopefully avoiding duplication of services within the community. And the partnership can be good for both sides from the, I guess, the perspective of capital. Going into a partnership may provide an ability to expand faster and enables both sides to reduce downside financial risk through the sharing of startup and startup capital and the capital required to operate the model on an ongoing basis.
Okay, great. Let's see, Joshua, is there anything you'd like to add to that one?
Nope. I think that was well covered.
All right, perfect. Todd?
Yeah, I think that that Steve hit most of those high points. From the health system standpoint, you have that quality, safety, brand recognition piece we've spoken about on a couple of the previous questions. I think you have a lot of data and market demographic information that you can glean from the health system. And Steve mentioned the employee base. I think that's a key component of it for sure. And then when you think about the urgent care management company, that independent partner, you have, I think, significantly more management and development expertise, certainly within this particular service line. I think you have greater speed to market capabilities. You have that focus on a specific service line, and that permeates not just the operational management, but the revenue cycle component as well. All of the health systems that any of you might be partnering with have very sophisticated revenue cycle functions, but they're tend to be more focused on big dollar DRG-based reimbursements and not as focused on this specific service line. And I think the urgent care operator can bring some additional focus to that component. I think you would typically expect tighter operational control and a tighter model coming from the management company component. And I think you just get more of that nimble operational approach compared to the way most health systems usually approach these ambulatory service lines. They just don't have as much time to focus on that as they're trying to build a much larger integrated system.
Great. Lee, do you have anything to add to that before we move on?
No, sir.
Okay, perfect. All right, next question is, what are potential challenges to be aware of for either side entering into a joint venture? We'll start off with Joshua on this question.
Sure, and some of this has already been touched on in the responses to the earlier questions, but one of the key challenges in a joint venture will circle around the terms of the ongoing governance between the parties, and in particular the level of control that one party may have relative to the other party. That can go from anything from the board composition and who controls the board to certain decisions with respect to key matters, such as the ability to bring on and incur additional debt, or entering into payer contracts, or entering into contracts with affiliated parties. So all of those types of ongoing operational and governance decisions are things that need to be sorted through between the two JV partners as part of the negotiation of the operating agreement. And in many instances, the parties, particularly if it's their first joint venture, without having had any type of historical relationship, can come to the table with a very different set of expectations between each other. And the ability to collaborate and work through those issues is in many instances a challenge. Additionally, questions around whether or not the joint venture is really focused on a single site, or is this about a broader platform for which the parties are going to agree on mutual exclusivity. And exclusivity can be, in some instances, a tremendous competitive advantage, but in other instances, it could be a tremendous challenge as well if you're not partnering with a system or a management company that sees and views the same type of growth as the other party. And so dealing with the issue of exclusivity, which also touches on non-competes, can also be a key challenge. Capitalization, how much funds will each party contribute to the venture. In some instances, a health system may feel that its brand itself should be the value that's being contributed. There are potential healthcare regulatory and fraud and abuse concerns, however, that could implicate. So that's not something that should be treaded on lightly, or at least it should be addressed and ensure that the parties are looking at it from the same perspective in terms of making sure that the company is, one, properly capitalized, and equally important, to the extent one party is putting in more capital than the other, that that you're not tripping across any fraud and abuse concerns by doing so.
Great. Thank you very much. Oh, go on, Josh.
Yeah, just one other point. The EHR system and how integrated that system will be to the urgent care platform relative to the hospital may also be a challenge that needs to be sorted through. Will the urgent care system, particularly if it's already operating, continue to have its own EHR system, or is it going to be required to migrate onto the hospital system? And if so, how will patient records and the ownership of those patient records be handled both during the venture, and equally important, if there was a separation, how would those be addressed? And then finally, focused going into a venture knowing that if it doesn't work out or there's a liquidity opportunity, what restrictions, if any, would be imposed on one party to be able to sell their interest to either a private equity fund or another strategic buyer. Health systems can be very sensitive in terms of who they are partnering with, and that may impose restrictions on a JV partner's ability to sell.
Okay, thank you. Lee, do you have anything to add to that?
Yeah, sure. So I come from a little bit of a different perspective than Josh here, just because I'm an operator and a clinician. So Josh covered a lot of important challenges that come up when you're setting up these agreements. I'll speak a little bit to some of the operational challenges, as it were. So I think these fall into two main buckets. One is what I would call org structure, and the second being workflow. In org structure, my point here is you essentially have to have an organizational structure to support the relationship, to service the relationship. And it's hard to gauge exactly what that means and how many more resources you need to service that relationship. A lot of that depends on whether you are the sole provider of urgent care services or one of many. But in our situation, we are the sole provider of urgent care services for our healthcare partner, and we have to service that relationship in a number of ways. And so that changes your org structure, and just to kind of cut to the chase, it adds corporate overhead. So the bottom line there is there's a significant cost to servicing the relationship. You have to consider that cost moving in because you want to understand, well, what's the return on that investment. The second piece, perhaps a little bit more important, is the impact to urgent care workflow. Urgent care workflow and health system workflow are diametrically opposed. Quite frankly, urgent care was founded on the principle of doing healthcare differently, not doing it the way health systems do it. And while health systems are doing a much better job recently of improving efficiencies and improving the flow of patients through the network and through encounters, they're still a far way off. So that's critical. The reason why it's costly to the urgent care through simple math. At the end of the day, if the workflow clogs, adds, including the EMR, adds say 5 minutes a patient, and you see 50 patients a day, you've lost 250 minutes of productivity. So time is money, very much so in the urgent care world, where every patient counts, and the number of patients to throughput is entirely dependent on workflow and efficiency. Specifically to the EMR, health system EMRs are not designed around workflow. They're designed around data gathering and designed around meaningful use and government regulations. It creates a tremendous problem for an urgent care operator if they don't have experience doing it. So, it takes some time, it takes some level of sophistication to take a health system EMR and make it urgent care friendly. And if you don't have the energy to do that, or you don't have the gall, the chutzpah, so to speak, to do that, don't get into the game, at least if the requirement is to integrate their EMR.
Okay, thank you. For time purposes, we're going to go ahead and move on to the next question. And this is, what are some regulatory issues that need to be reviewed in a joint venture with a hospital? So we'll start that off with Josh and then pass it on to Steve afterwards.
Sure. So before even addressing the regulatory issue, I think payer contracting is probably one of the key issues that we would suggest that an urgent care center focus on, predominantly because we are seeing a recognition by a number of commercial payers of the distinction between an urgent care provider versus a physician office. In the past, that distinction was very blurred, and many urgent care clinics were really just operating as walk-in centers that were physician offices. A number of payers, though, are making those distinctions and are reimbursing based on that distinction, allowing true emergent or walk-in services to be done in a urgent care center where a location is identified as an urgent care center or credentialed as one, as opposed to allowing those services to be billed if that same location is operating or credentialed as a physician office. Going to the regulatory implications, those can be bifurcated into two baskets, one being federal, the other being state. From a federal perspective, you've heard many of us speak about or talk about how an urgent care platform can create some additional drive of patient flow into hospitals. That certainly can implicate fraud and abuse laws like the Stark Law, like the anti-kickback statute. And so understanding how the venture is being structured and addressing those concerns is critical to a sound legal structure and sound regulatory compliance. From a state law perspective, most states have a baby Stark law or a baby self-referral law that often operates in a manner consistent with the federal laws, but not necessarily identical. And so keeping those in mind and how that may impact the structure is also critical. Similarly, and we touched on this earlier, corporate practice of medicine can vary from one state to another. By way of example, in Florida, Florida generally does not prohibit the corporate practice of medicine. And so many urgent care centers can be structured as just a true joint venture among a hospital and non-physicians. By contrast, in other states, and I would say the lion's share of states, that same model has to be turned around a bit to ensure that any physician employment is being done properly through an entity that is structured as a professional corporation and is owned by a physician that's licensed often in that state. And then finally, from a regulatory perspective, we focus on Medicare reimbursement and whether or not the urgent care center is going to just be enrolled in Medicare as a physician office or a clinic as opposed to some sort of other status associated with a hospital outpatient department. I would say that the latter is more of an exception, but there have been instances where we've seen HOPD status involved with urgent care centers, or at least parties discussing it. And so that is another layer of regulatory complexity that should be addressed on the front end to make sure that that's not overlooked.
Okay, thank you. Steve, do you have anything to add to that?
I think Josh, covered that very well. I'll just throw out there that if you're joint venturing with a nonprofit health system, it's going to be important to make sure that the company operates in a manner consistent with their tax-exempt status. It may require that you address your charity care policies in order to make sure the company operates in a manner that promotes the health of a broad cross-section of the community. That'll require you to analyze, charity care policies, the handling of Medicaid patients, and so forth. And then last comment here with this topic, we're seeing more and more government activity, and I think urgent care is likely to see more going forward. And whether or not the outcome will be favorable or unfavorable for urgent care will ultimately depend on the people at the table.
Okay, thank you. Let's see, Todd or Lee, do you have anything to add to that?
This is Todd. I'll just add that, and I think Josh and Steve covered it quite well, is, mission. So Steve spoke to the tax-exempt status. I think depending on the nature of the health system that you might be partnering with, mission can certainly come into play, and that will oftentimes hit both the tax-exempt status, the charity care policy, but could hit other aspects. And then one other, I don't know if hurdle is the right word for it, but certainly something to keep in mind as you think about partnering with a health system is how the urgent care joint venture will play with the existing physician network and development going on with that health system. And more often than not, that's potential friction with the existing primary care network. And I think you need to spend quite a bit of time educating and helping that group understand where urgent care fits in the overall continuum, and trying to comfort the primary care folks that the urgent care joint venture is not there to supplant them or to otherwise take the business that they have, but it's really just another aspect of the offering of an integrated health system.
All right, wonderful. Sounds like that topic's been pretty well covered, so we will go on to wisdom and war stories. Lee, do you have any advice for those contemplating a joint venture in this field?
Yeah, look before you leap. There's just a lot of detail, and it requires therefore requires a great deal of attention and a certain level of sophistication. We've talked about a lot of the legal and regulatory components to it, the operating agreements that can get pretty complicated and require some expertise to navigate through. I think more than anything, it's critical to have expectations very specific and very aligned. One of the things that we did when we were approaching our partner is we asked them for the 3 things they can't live without, and we said we would do the same. So it really just kind of lays it on the table and doesn't catch you off guard. In other words, one of the top 3, in fact, the #1 thing for our health system was that we would integrate with their EMR. That's kind of good to know because they were on a health system EMR that's not typically used in urgent care, and if we weren't willing to do that, it's probably not a good partnership. So, and the other reason why you do a top 3 is not everybody can get everything they want out of these things. If you can get the 3, that's great, and we were able to find alignment on each of our top 3s, and that's why our relationship made sense. So it's kind of a very simplified way to approach the discussions before you get knee-deep in the operating agreements and dealing with all the regulatory issues.
Great, thank you. Todd, do you have anything to add to that?
I think Lee's done a really nice job of laying that out. I think broadly I would say that these types of joint ventures are certainly complex. They take quite a bit of time to pull together. In terms of the war story component, I would just say assume how much time you think it's going to take to put one of these joint ventures together, and then you ought to probably double it at a minimum in terms of what reality is. And I do think that Lee made a comment earlier about corporate overhead. I think it was a terrific point of understanding that it's not just going to be like operating your own independent urgent cares. There is a component of keeping your health system partner happy, having to integrate with them on a number of different levels, whether it's their compliance group, it's their IT function. It's a big drain on the urgent care operators' resources, and then oftentimes you do have to have additional bodies in there to really help keep those relationships productive and moving in the right direction, and when it comes to the corporate practice of medicine or the payer contracting points that Josh has spoken about, those are real issues that take, a lot of expertise on both sides to figure out, and I think the best advice I would give is understanding what you are trying to get out of it. It plays into Lee's comment about look before you leap. I think you have to really look yourself in the mirror and understand what are you trying to get out of this partnership, and given the things that you're going to have to give up in order to make this work, does that, ultimately, accrue to your benefit in the long term?
Wonderful, thank you. Steve, do you have any quick thoughts you want to add to that before we move on to the last question?
I think, Lee and Todd have done a very nice job on this. I would say, avoid making assumptions. Very important to put everything on the table on the front end, have a very clear understanding of the philosophy and goals of both sides, and an understanding of the expectations of both sides. Extremely important to have all the right partnership documents in place, and avoid overlooking, important partnership details.
Wonderful, thank you. So the last question is actually, we're going to go down the line, and each of you can answer this one where you think it might be the best answer. Where do you think the urgent care market is going to be going in the next few years with these types of joint ventures? We'll start off with Todd.
Sure, I'll give 3 points. I think we're certainly going to see more growth. I think each of us in our existing markets, sees a competitive landscape that is ever growing, and that's not just from other urgent cares or health systems getting into the business. It's certainly coming from retail, from primary care extension. So it continues to be a very competitive market. That's probably a very obvious point to anyone who's in it right now. I think we're going to see quite a bit more consolidation, collaboration, and partnerships, and that's going to be true certainly as all of us are involved in it with health systems, but I think you're going to see that with other potential partners as well, whether that's payers or other folks in the healthcare continuum. And then the third point I would make is I think you're going to see considerably greater focus on that end consumer, on the retail nature of what urgent care can and really should be in a true B2C model. I think urgent care is on the, is the tip of the spear as you think about true B2C movement in healthcare, and I think you're going to see a much finer point on that as we move forward.
Okay, thank you. Joshua, do you have anything to add?
Yes, certainly. There are certainly opportunities in the urgent care space. One thing that I'm a little bit, I would say, concerned with is the way that technology may be transforming the way in which healthcare is delivered. And I think that urgent care centers need to stay ahead of the game in that regard. There are a number of, it seems that there are a number of telemedicine companies that are cropping up as well. And they may not initially be perceived as a direct competitor to urgent care. They may be just an enabler of a different type of service, but I could also see at some point that there being a crossroad there and some competition being generated from the fact that new technology is allowing for innovation and care being delivered in a different manner. We're also seeing a fair amount of payer diversification where payers are directly investing into the provider market, and so urgent care centers will need to stay ahead of that game as well in terms of just making sure they're well positioned to the extent payers start creating any type of closed panels or closed models. We're also seeing a number of clinically integrated networks that are small, sort of smaller in region, where a physician entrepreneur or other individual with a vested interest in the healthcare industry creates sort of a platform surrounding around an outpatient strategy. So whether it be a physician office coupled with the walk-in clinic, coupled with the diagnostic center and the surgery center, those are cropping up in a number of regions, and that can be a competitive threat as well. Overall, I think the urgent care market is going to continue to grow, but I would just, as a word of caution, suggest that urgent care centers, as they exist today, need to continue to think about what is their value proposition and how will they continue to innovate as we see healthcare delivery transforming in our country.
Thank you very much, Joshua. Lee, what are your thoughts?
So I think that the biggest mistake I see people, stakeholders making in this space, including investors, is making decisions based on past performance and past market dynamics. And you would think investors would appreciate the fact that in any rapidly growing space like urgent care is, 1 year is already a decade ago. And so you really have to be, you have to have vision, I think, to get into this space, and you have to be a futurist, because what worked 5 years ago is not what will work for the next 5 years. I'll give you an example. The last 10 years for urgent care, the reason why we grew so quickly is our value proposition was an access proposition. This is a different kind of access than others have been talking about. When they mention access, they mean an access point for the health system. I'm just talking about access for the consumer to health care. So urgent care was an access proposition, which meant, hey, we're open late, we're open 7 days a week, we can do procedures, we don't require a schedule, doors always open kind of thing, and a lot less expensive than the emergency room, with a side of customer service to that, okay? So all you had to do is prop up your urgent care, open your doors, and you were seeing 40 patients a day. Well, of course, access in a super saturated marketplace isn't good enough, okay? You've now got, several entities offering access, some virtual access, some direct competitive urgent care is now one on every corner, kind of like the mad rush with Starbucks and coffee companies as well as pharmacies. So the dynamic changes dramatically, and if you're still promoting your access, you're not promoting the future of urgent care. So the way I look at it, and Todd mentioned it, and I just want to reemphasize it, it's really about the consumer. So what is it that the consumer demands, and is that different now than it was 5 years ago? And the answer is absolutely yes. So while first they were demanding access, now they're demanding no wait times. They're demanding a patient experience that is exceptional and different from what else they can get in healthcare. And so it all boils down to those two things as your key business drivers. It's going to be who gets them through faster and who creates the best experience. To get that out of your staff, to get that out of your facilities, to get that out of your whole purpose and strategy, you have to be a sophisticated operator. You have to measure things that impact your key business drivers, and you have to be able to manage to those metrics relentlessly. And so it's not for the weak of heart. And I think some of the independent ideas that started all of urgent care and the mom and pops that have entered into the market over the last 10 years are going to begin to fall off because of that.
Thank you, Lee. And then finally, Steve, before we head into our question we have from the audience, Steve, where do you see the market going?
Well, you guys took the words out of my mouth. I mean, there's increasing consumer demand for immediate treatment, and there are various models of healthcare delivery out there and in development. There's telemedicine and other online platforms, traditional primary care, extended hours primary care, retail health, urgent care, freestanding EDs, I could go on and on. At the end of the day, those models that are more convenient, focused on cost containment and quality, and those that are more efficient will ultimately do well. We have to be better than the other alternatives. I do believe that, urgent care, the urgent care model works. It's what consumers are looking for, so I think urgent care will continue to play a very important role in healthcare going forward. Having said that, I think there will continue to be a lot of consolidation. Urgent care is still a very fragmented business, a fragmented industry, And I think we'll see, more integration with payers and health systems and expanded capabilities to provide overall, better overall coordination of care.
Okay, thank you. Thank you so much. So we're going to jump right into our Q&A, but before we do, I did want to say thank you to Joshua Kaye, Dr. Lee Resnick, Steve Sellars, and Todd Latz for joining us today. The one question that we have today it says, any advice for a situation where we are not entering into a joint venture, but rather we are co-leasing a building where we run the UCC and the hospital provides lab, x-ray, and a PT rehab component. So I'm gonna take a guess that this is they're trying to figure out how to get along with the hospital in this type of a situation. Does anyone want to jump in on that one?
Sure, this is Todd. I'm happy to answer, Richard. I think that, what you have there, right, is trying an attempt to try to find a way to partner with a health system outside of the context of a, formal joint venture or formal partnership. I think it's important, right? I think all of us think about co-tenancies and how to be, better neighbors and how to drive the impact to our business. I think the first question is, are there overlapping services? So is the urgent care also operating lab and x-ray? Because that's not ideal, but perhaps if that is the case, there's a way to, to coordinate those services with your, health system neighbor, or to otherwise ensure that you aren't duplicating services in the market. As we think more broadly from a population health perspective and just from a public policy standpoint, it adds cost into the healthcare system if we have two different operators, two different entities offering the exact same service side by side. And so I would just encourage the entity asking the question to find a way to connect into whoever is responsible for that particular component of the health system, and just seek ways in which you can participate in some, legal but mutually beneficial ways to both help foster their business. If it's, an easy and convenient piece for you to offer to your patients, a way to get additional services, for instance, the PT component, and then is there a way for you to be the provider of choice from an urgent care standpoint, similarly for patients coming out of the health system?
All right, thank you, Todd. All right, so we want to once again thank our panelists for joining us today, and thanking you for joining us today. Be sure to check out the Ambulatory M&A Advisor at our website, www.ambulatoryadvisor.com. You can find us on Facebook and Twitter as well. And once again, we wanted to thank Ambulatory Alliances for sponsoring this webinar and making it possible. You can visit them at ambulatoryaLliances.com, especially if you're looking to buy or sell an urgent care center or physician-owned practice. You guys have a great day. Thank you for joining me. My name is Richard Romero, and we will see you at the next webinar. Goodbye.